Will the Committee of Supply please come to order? This section of the Committee of Supply will now resume consideration of the estimates of families. As previously agreed, questioning for this department will proceed in a global manner. The floor is now open for questions. Ms. Adams.
Thank you. Just let me pull up my questions. In November, we heard concerns from EIA recipients about the long wait times and lack of communication. Can the minister indicate what is the processing time between people applying for EIA and receiving EIA?
Minister Squires.
Thank you very much, and I want to thank the member for the question. And as I had explained to her in last estimates period, we do not have a wait list on EIA for income, employment and income assistance or disability income support assistance. We assess each applicant immediately, and at times, if all the documentation and all the application, if the application is complete, then the individual can receive assistance immediately upon intake. When there is future information to be garnered and the applicant needs to return with particular information, we are able to provide that applicant with emergency assistance to help bridge that gap between the time in which they're making the application and the time in which they start to receive those benefits. And I can also update the table with information about a new call center that we have, which is helping expedite applications for individuals. And then we've also set up some information and a portal on our website to assist clients who are preparing to make an application, to help them ensure that they have all the information that they need so that they can be assessed and approved immediately.
Ms. Adams.
My colleague from the PAW, Cami Sack, is going to ask a few questions now.
Ms. Laughlin.
Thank you, Mr. Chair. I would like to ask a question on the Manitoba Advocate for Children and Youth report. When the Act was proclaimed in March 2018, 2 sections were left in limbo. One would expand the advocate's ability to investigate deaths of children who are not in the care of the Child and Family Services system. The second would empower the advocate to investigate serious injuries of children who have had contact with the mental health, addictions, and justice systems. The first part of the Act was finally proclaimed a few weeks ago. Can the minister provide a timeline as to when the second part of the Act will be proclaimed?
Minister Squires.
Thanks, and I appreciate the question regarding the Manitoba Advocate for Children and Youth and our government's commitment to working collaboratively with that office to ensure better protection for children and youth in the province of Manitoba. As the table will recall, our government had introduced the legislation, which certainly did respond to calls to action on the Phoenix Sinclair report and the recommendations that followed from the tragic death of Phoenix Sinclair, and Justice Hughes' recommendations to expand the office of the advocate. And so we did that in 2018. And then, as the House will know, last Monday, I was very pleased to announce jointly with the acting advocate the expansion of the authority that the advocate's office has to investigate and review services relating to any child or youth who has received services through the Child Family Services Division, mental health, addictions, or justice involvement. And as of now, or as of June 1st, which is today, the advocate has the authority to investigate and review any services pertaining to any youth or children involved in these 4 systems. The final standard to proclaim in the legislation is being worked on in conjunction with the advocate, and it is something that we're doing very collaboratively, and ensuring that the advocate's office has the capacity to take on this final piece of work that our government had introduced in the legislation that we passed a few years ago.
Ms. Laughlin. Ms. Laughlin, we cannot hear you. You might want to check to see if you're muted or not.
I was muted, thank you.
Ms. Laughlin, go ahead.
Okay, the 2021-22 budget has the combined spending for child protection and block funding to CFS agencies at $497 million. That's 1% lower than the previous fiscal year and well below the $519 million spent at the end of the 2018-19 fiscal year. Can the minister explain the $1.6 million to child protection under financial assistance?
Minister Squires.
Thank you very much, and I appreciate the question from the member about some of the things that our government is doing to reform CFS and provide better outcomes for families. Along with going towards single envelope funding, our government has also reduced significantly the number of emergency placements, which is significantly, not only is it better for children and youth, it's also cost efficient. And by that, I mean, it costs a lot more money to be placing kids and youth in hotels and other emergency placement services than it is to have kids in an actual care home. So, for example, in 2014, a statistic from that year, we had 432 children in emergency placement, and the total number of children in emergency placement for this past year was 148, which included 85 in an emergency shelter and 63 in a foster care home. And of course, we do not use hotels. And so there are not only better outcomes for children and youth, but more efficient delivery of service.
Ms. Laughlin.
Thank you, Mr. Chair. I just want to focus on that same budget, 21-22, where the combined spending for child protection and block funding to CFS agencies at $497 million. That's 1% lower than the previous fiscal year and well below the $519 million spent at the end of 2018 and 2019 fiscal year, same as before. My question is, can the minister explain the 1.5 million cut to child and family services authorities under financial assistance?
Minister Squires.
Thank you very much, Mr. Chair. And I can confirm for the House that under the former NDP government, there were 11,000 kids in care, and today there are roughly 9,800 kids in care this year. That is a decrease in 4% of kids in care from the previous year, and a total of approximately 11% reduction in the number of kids in care from when the NDP were in office. In regards to the $1.5 million that the member is referencing, I can also confirm for the House that our government was not comfortable with a for-profit agency contracted by the members opposite. When the NDP were in government, they had contracted with a for-profit agency to deliver care. Our government was not comfortable with the care provided by this for-profit agency, and we terminated the service purchase agreement with BNL, and that resulted in a reduction in administrative costs of $1.6 million.
Ms. Laughlin.
Thank you, Mr. Chair. I have another question for our minister. We're hearing from CFS workers and social workers about unsustainable CFS caseloads. The Phoenix Sinclair report recommends no more than 20 per caseworker, but some are reporting caseloads as high as 30. Can the minister provide the average caseload for Manitoban CFS workers right now? Sam.
Minister Squires.
Thank you, Mr. Chair. And I can say that our government is very proud to support the work of our CFS workers and our social workers who do incredible work on each and every day to help keep children in our province safe. One of the things that we know, and it was certainly brought to light by the Phoenix Sinclair inquiry and the following reports, was that caseloads were in many cases too high, and that put an incredible strain on the CFS agencies and their workers, which also meant kids were potentially not receiving the utmost care that they deserve to stay safe and to get the help and the support and the nurturing that all children in our province deserve. And so those are lessons that we learned from the Phoenix Sinclair inquiry, and some of the actions that our government has taken is on the preventative side. Undoubtedly, that is key in any initiative to not only help the sector, but to also ensure children are better cared for. And by preventative, we mean by we have invested in a variety of projects, such as the Granny's House. We've opened up are funding the second respite home, which is to help prevent kids coming into the system by offering that much needed respite for parents. We've also invested in an Indigenous doula program, the Mothering Project, Super Dads program, Community Helpers program, as well as ending the practice of birth alerts, so that we are keeping more kids at home with their families and more kids in their own home. And that is why we're seeing the reductions that we've got down from 11,000 kids in care under the NDP to 9,800 today. And yet we maintain that funding for the authorities to flow to their agencies and to provide the services for the children and youth under their care. So our government is making more investments and are working on preventing more children from coming into the system. And we know that this is getting results when we keep families together and provide parents with the skills and the tools to create that loving, safe home. That it is definitely the goal for any agency, any authority, and definitely for this government.
Ms. Laughlin.
Thank you, Mr. Chair. I didn't really hear anything about numbers of caseloads for our CFS workers. So let me talk about the workers. Can the minister tell us how many CFS workers are there currently, and how many CFS files, and broken down by region, please? Egosa.
Minister Squires.
Thank you, Mr. Chair. And I would hope that the member opposite is aware of the devolution and the system that unfolded as a result of devolution under her government, whereby we have agencies that are able to determine their own staffing levels and that they receive funding from an autonomous authority. And our role is to provide the authorities with funding, and they have the autonomy to make those decisions independent of government. They are arm's length, and therefore we continue to flow funding to the authorities, which then work with the individual agencies on determining appropriate levels of resources and staffing. And if the member is unsatisfied with a particular authority or agency, she's certainly welcome to discuss that with that authority. They have a mechanism for receiving input, or if she would like to share information about a particular case with me that she's aware of, or a particular agency that she's aware of. But ultimately, she needs to know that under devolution, the authorities are operating at arm's length from government.
Ms. Laughlin.
Thank you, Mr. Chair. My next question is, in 2017, the province changed the way they count children in care. They stopped counting children who live with a designated guardian or family member, even though they are legal wards of CFS. That meant a 4 to 8% reduction in the reported number compared with statistics provided by CFS agencies. Can the minister provide the total number of how many children are legal wards of CFS, including children who live with a designated guardian or family members? Lots of cases here in the north here. Egusen.
Minister Squires.
Thank you, Mr. Chair. And as the member knows, that many experts have agreed that keeping children together with family, whether that be in their own home or with extended family members, is ultimately in the best interest of children in most cases. That is the expert recommendation. That is also best practices that are being used in this jurisdiction and many other jurisdictions across the country. And that is something that we know is a recommendation of many inquiries and reviews that have been conducted throughout the province. And so we're and the member also knows that each year in the annual report, the number of home placements is reported, and I can confirm for the member that as March of 2020, that number was 527. When the new number is tabulated, current the fiscal year ending March of 21, that will be reported in the annual report in September. And I certainly look forward to having future discussions with her about it at that time or in next year's estimates. But we certainly know that keeping families together and having children living with relatives or guardians is certainly better for the children. There's better outcomes for the children in most cases, and it follows best practices. And that is something that we're going to continue to work with whenever possible, is reunification and not lower apprehensions, and just keeping families together will get us better results than was received when the NDP were in government, and they were apprehending an average of one newborn a day under the archaic birth alert system, and they were housing kids in care. And in one extreme case, the Minister of Families admitted to having delayed children and youth who were incarcerated were staying in their incarcerated facility longer than they needed to, according to a CBC report in 2015, because there was no place for the kid to go as required by the province at that time. And so the answer was to keep these kids in emergency placement, in hotels, and in the worst cases, incarcerated. We think that there's a better approach, and we're going to continue to follow that better approach so that children are with family and loved ones.
Ms. Laughlin.
Thank you, Mr. Chair. I have a really important question here to ask, including I'm part of my family too. During the pandemic, family visits stopped in Manitoba in October 2020. It's now June 2021, so that's 8 months ago that we have not been able to see our nieces. My daughter hasn't been able to see her two younger sisters. I could see a lot of money being saved through respite. I could see a lot of money being saved for dollars that are given to families for groceries, activities, all that. I can just see it sitting. What is going to be done with this expenses that are not being spent for children and families for their mental health? They haven't seen each other in 8 months. What is going on there? What are going to be the consequences of that separation, right? Separation. You're talking about keeping families together. Explain to me, what's going to happen to all those dollars? Are they going to be well spent to try to make a connection with families and, you know, and their birth parents, even foster parents? There's really good ones out there. You know, just what are the connections that are going to be made for our children to survive this? Never mind trying to go to school. What about seeing their siblings? What about those kids that are in those horrible foster homes that we all know exist? Egosa.
Minister Squires.
Thank you, Mr. Chair. I do want to take a moment to acknowledge some of the supportive work that that everyone has done throughout this pandemic, whether they worked for government directly, were CFS workers working for an agency, or someone within the authority. I do want to make clear that public health never issued a directive that respite or family visits needed to end. And in fact, our government has supported the continuation of all these services by providing PPE and continuing the funding through single envelope funding to the authorities for all of these services. We know that there have been some instances where agencies themselves have put an end to the respite or the family visits, and we know that it did not come from a recommendation from the department or from public health. We also know that if in cases of surpluses that the agency or the authorities, pardon me, have the ability to invest their surpluses that they might have occurred during this year because of offering fewer services throughout the pandemic. They certainly have the autonomy to reinvest those services in enhanced supports for their families. Our government will be encouraging authorities to be reinvesting any surplus they have towards that end, as what the member had elaborated on in her question. We will be strongly encouraging those authorities to look at investments in those areas. And if the member would also like to make that encouragement upon the authorities, it would be greatly appreciated, because I certainly am in agreement with her that if there were any savings, if there was any surplus obtained during the COVID-19 pandemic that resulted from fewer services being delivered to our most vulnerable youth in the province, that those dollars need to be reinvested in those children and their families.
Ms. Laughlin.
Thank you, Mr. Speaker. My next question is, more than 10,700 children were in care in Manitoba as of March 31st, 2018. Almost 90% were Indigenous. The province had the highest per capita rate of children in care in Canada and apprehended about one newborn a day. However, right around this time is when the department decided to move ahead to implement block funding for CFS agencies. Our concern with this change is that there leaves the potential for deficits with certain agencies which see higher caseloads than others, leading to potentially unsafe levels of staffing and care. One of the things that was mentioned in the pilot project for this was a contingency fund, which would provide agencies with funding if they were spending over the amount they received through block funding. Can the minister share if this contingency fund is being developed and what the timeline is on this?
Minister Squires.
Thank you, Mr. Chair. So I do want to remind the committee that in fiscal 17-18, we had increased the funding by $15 million to the authorities as we moved to single envelope funding. And since then, we have seen a reduction in kids in care at each of the authorities, and we have maintained that level of funding. The member will also know that under devolution, we have 3 out of the 4 authorities that are led by and governed by Indigenous leaders. And our government has empowered the Indigenous leadership at each of the authorities and communities to and have the autonomy to govern the authorities and the agencies appropriately in the best interest of the care of their children and their communities and their families.
Ms. Laughlin.
Thank you, Mr. Chair. The next question is, in last year's poverty reduction strategy budget paper, the Manitoba government committed to investing $250,000 in 2020-21 to recruit, train, and employ community helpers to provide services that reduce the risk of child and family services apprehension or placement breakdown. Can the minister share any results she has on this program so far? Sorry, Egusa.
Minister Squires.
Chair, and our government was very proud to invest the $250,000 in the Community Helpers Initiative. And while the work of that program and the formal evaluation is still underway, we have heard anecdotally from many of our community partners that it has been, that there were successful outcomes, and really want to thank them for their involvement and their partnership. And I look forward to the formal evaluation being complete.
Ms. Laughlin.
Thank you, Mr. Chair. My next question is, Can the minister provide any updates on the province's partnership with the Métis Child and Family Services Authority on a new pilot project that will provide mental health and addiction services to families at risk of child apprehension? How much has been invested into this program so far, and how many staff employed on this that are employed with this project? Eggleston.
Minister Squires.
Thank you, Mr. Deputy Speaker. And our government thinks that this program is incredibly vital to helping parents who are at risk or experiencing addictions and other challenges, that they are getting the help and the support that they need. And this is, of course, an effort to keep families together. And as the member knows, our government has provided a total of $1.8 million to the Manitoba Métis Federation to run this program. And she'll note that we're only 2 months into this current fiscal year, in which the program is still underway. It is still it's an active program right now. We will have an evaluation program at the end, as we do with all of our programs that are being run as a quote unquote pilot. And and certainly hopeful and optimistic that there are good outcomes from this program that is being run by the MMF. I do also know that there are other authorities that are interested in the learning about the success of this program and wanting to potentially expand it. So we're making those evaluations right now, and we'll certainly look to expanding it if there are good outcomes that have been obtained by this initial 3-year program. But if the member wants to know specifically what the outcomes are to date, she would be better to pose her question to the leadership at the MMF, as they are the ones running the program.
Ms. Laughlin.
Thank you, Mr. Chair. I have no further questions. I'm going to pass this on to the member for Point Douglas. Thank you.
Mrs. Smith.
Thank you. I want to thank my colleagues for giving me the opportunity to ask a couple of questions. So I just wanted to go back to the 9,800 kids in care and ask how many of those kids in care are with family members? How many of them are only receiving medical benefits? And what is the minister doing to ensure that when kids come into care, that they're actually, families are asked to take them first before anyone else?
Minister Squires.
Thank you, Mr. Chair. I can confirm for the committee that all children in care are eligible for health, dental, and optical care. And in regards to the other question the member asked, CFS agencies, as the member likely knows, must follow national standards which allow that Indigenous children should be placed with family first as a priority. That is a national standard. That is a standard that the Manitoba government upholds. And we certainly continue the practice of following those national standards.
Mrs. Smith?
Miigwech. Well, the minister didn't answer my question. I get that all kids in care receive health benefits, but I asked how many specifically were only receiving healthcare benefits and not financial support, because I know a lot of families get care of their family member, but they're not given support by CFS. I know of some families who have had to move in with other family members because they're not being supported by agencies, and that's unfair for families because they want what's best for their family member as well. But then it's putting them into poverty and putting them into situations where they have to choose whether they take their family member or not based on financial situations. And that puts kids into care of other families. So I'll give the minister one other opportunity to answer the question: how many kids are only receiving medical benefits and not financial support from CFS agencies out of the 9,800 kids that the minister had prefaced? Thanks.
Minister Squires.
Thank you, Mr. Chair. And the member should know that under devolution and then the single envelope funding, that we have given the authority to the agencies, the autonomy to the authorities and the agencies to determine and provide financial supports to the children who are in care and in the care of relatives. And we are certainly not making those decisions in the Department of Families. That is the autonomy of the authorities to work with their agencies in determining better outcomes for their children and their families. They are provided the single envelope funding, which is annual amounts that they are provided to then work with their agencies in ways to best support the families in under their care.
Mrs. Smith.
Thanks. Well, it's unfortunate that there's no oversight because this is happening in a lot of agencies and there's a lot of families that are being left without any financial support and a lot of children that are living in poverty as a result of this, and families trying to do the right thing in taking care of their kids so that, you know, they're not ending up missing or murdered or in jail or, you know, dying by suicide, as we know what happens when kids are in care. So I hope the minister will look into that. And that's all the questions that I have. Thank you.
Minister Squires.
I don't think there was a question there, Mr. Chair.
Okay. Ms. Adams.
Thank you. Rent assist and EIA assistance recipients will receive an increase to their benefits between 2.4 and 11%. However, many have argued this change will not make a significant difference unless their thresholds are changed. This threshold has been lowered by previous governments in previous years, excluding Manitobans from the program. There are also concerns that single-member households are being treated unfairly under the current rent assist program. Has the department considered increasing the threshold for rent assist recipients? And how many rent assist recipients are currently on the province's both or EIA?
Minister Squires.
Thank you very much, Mr. Chair. As the member knows, annually we increase the EIA rent assist budget every July, and it is based on the median market rent. And currently we have an average of 24,000 renters in the private market or owning your own home receiving the EIA rent assist benefit. We also have an average of 7,709 non-EIA rent assist clients. And as the member knows, we have quadrupled the budget to $54.4 million since our government took office, so that we could have more individuals who are, facing housing insecurity or precariously housed with opportunities to maintain stability in their housing accommodations. And that is why we've quadrupled that budget, and will continue to make investments so that all Manitobans can have an affordable place to live.
Ms. Adams?
Thank you. With the government choosing to have CERB be counted as income, how many Manitobans are at risk of losing their rent assist because this has bumped them up above the allowable, above the threshold? And is the minister willing to consider increasing the threshold, given that her government made the decision to include CERB as income?
Minister Squires.
Thank you, Mr. Chair. And effective July 1st, as the committee may know, and very proud to announce that our government has increased the threshold to 80%. And that means that for the first time, there will be families and households who are potentially earning higher income still eligible for the rent assist benefits, because we have increased that threshold to 80%. And we anticipate having more people than ever coming into this program and receiving benefits. And as the member knows, we also review the program each year to ensure that we are meeting the outcomes based on the community need.
Ms. Adams.
We are going to be closing out families today. However, I will have my colleague, the MLA for River Heights, ask a few remainder questions before we officially close out.
Mr. Gerard. Mr. Gerard, I believe you're muted.
I had asked 3 questions the other day at the end, but wasn't able to get an answer because we ran out of time. I don't know if the minister remembers those questions and can provide answers, or whether I need to repeat them again.
Minister Squires.
Thank you, and I appreciate the MLA's patience in receiving the answers to this. Last night, I was very pleased to meet with the subcommittee of the Ministerial Consultation Table on Early Learning and Childcare. And one of the tasks that this subcommittee has is looking at that very issue regarding retaining and recruiting people and having a strong strategy for workforce retention. And so they are tasked with that, and will be working in collaboration with our government and other sector partners, as well as other levels of government, to ensure that we have a workforce strategy to ensure that ELCC is a robust sector that people want to work in, and that they can stay in that sector and do the work that they love, as I find that most people who are working in that sector are attracted to the sector because they absolutely love the work. And so I look forward to the work of this subcommittee. I look forward to receiving their report and acting on those recommendations. In regards to the lead in drinking water in our childcare centers, I can confirm for the member that the Department of Conservation and Climate, as well as Health, are the lead in regards to the Auditor General's report on lead in drinking water. But I can confirm for the member that we have had 29% of our childcare centers participate in the voluntary testing program. And we are working to ensure that we've got greater uptake from all of our childcare centers to get the testing for lead in drinking water, and that there are only preliminary results coming in from the 29% of the centers that have received the testing. But I can confirm that there is going to be work that Conservation and Climate and Health will be the lead to not only increase the uptake, but also to work with any center that may have potentially higher than allowable amounts of lead in their drinking water, to assist in those remediation efforts, and that he should watch for those announcements very soon.
Okay, I'd asked...
Mr. Gerard?
Yeah, I'd also asked about the length of time for people to get EI. And although there's a 2-week wait for people to get an intake, sometimes things can take much longer because people need to get information, identification, for example, through vital statistics, and there can be a several months delay in getting that. And the other problem is that people who call in for an intake appointment may give a phone number, but somebody who's homeless or inadequately housed often doesn't have a phone, so that about a third of the time, I understand, when people call back for to do the intake, that the person is not available to answer the phone for one reason or another. Maybe there's a way of addressing this.
Minister Squires.
Thank you, and I appreciate the member's patience. Once again, I did forget, I was remiss in remembering his third question. I can confirm for the member that we do expedite our intakes, that there isn't a wait list per se, that as soon as an individual makes an application, if they're eligible, they receive benefits right away. We do understand that there is sometimes a delay. We're trying to reduce those barriers for individuals so that they can get their benefits immediately when they need them. I can also confirm that any delay, or there is never a delay regarding the delay in getting information from the Vital Statistics Bureau. We understand that there are sometimes applicants who are requiring documentation and that there is a lag time or a wait time in getting those necessary documents from Vital Statistics, but that is not, that does not preclude them from receiving benefits. We will bring them into the benefits program and start providing them with those benefits, and then we will work with them individually so that they can make application to the Bureau to get whatever documentation that they need. And we are, we've all opened up a call center and trying to make it more easily available for applicants to talk to someone and make that application. And we've also kept our offices open, and many of our employees, while they're seeing others across our province and across our country, have work from home accommodations to keep themselves and their offices safe throughout the pandemic. We know that that wouldn't work in many of our EIA offices, and so we had implemented some measures to ensure that our staff and our clients could be kept safe when they're working in the office. But we've kept those front-facing offices open wherever possible, as much as possible, so that people who certainly may not have ready access to a telephone or other challenges, that they are getting that service that they need as quickly as possible. But if the member has a specific incident or instance where he is working with an individual that is experiencing a delay, I'd be certainly more than willing to take a look at that and do a case review of that incident, because we know that now more than ever, we just need to lower our barriers and to provide services for individuals when they need them.
Okay, in the view of time, thank you. But I understand we now have to close out. So thank you for those answers. And I'll let us proceed with closing out the family's estimates.
Are there any further questions? Hearing no further questions, we will now proceed to consideration of the resolutions. At this point, I would invite all virtual members to unmute their mics so that they can respond to the questions. I will now call Resolution 9.2. Be it resolved that there be granted to Her Majesty a sum not exceeding $1,302,857,000 for families, community service delivery for the fiscal year ending March 31st, 2022. Shall the resolution pass?
Pass.
Pass.
The resolution is accordingly passed. Resolution 9.3, be it resolved that there be granted to Her Majesty a sum not exceeding $30,660,000 for families, corporate services for the fiscal year ending March 31st, 2022. Shall the resolution pass?
Pass.
Pass.
The resolution is accordingly passed. Resolution 9.4. Be it resolved that there be granted to Her Majesty a sum not exceeding $686,648,000 for families, child and youth services for the fiscal year ending March 31st, 2022. Shall the resolution pass?
Pass.
I must have been a vote if I stood here stuck.
The resolution is accordingly passed.
I thought you had gone home.
If I could get everybody to please mute themselves, that would be great. Thank you. Resolution 9.5. Be it resolved that there be granted to Her Majesty a sum not exceeding $134,187,000 for families, housing for the fiscal year ending March 31st, 2022. Shall the resolution pass?
Pass.
The resolution is accordingly passed. Resolution 9.6, be it resolved that there be granted to Her Majesty a sum not exceeding $67,000 for families, capital assets, for the fiscal year ending March 31st, 2022. Shall the resolution pass?
Pass.
The resolution is accordingly passed. Resolution 9.7, be it resolved that there be granted to Her Majesty a sum not exceeding $15 million for families, loans and guarantees programs for the fiscal year ending March 31st, 2022. Shall the resolution pass?
Pass.
The resolution is accordingly passed. Resolution 9.8, be it resolved that there be granted to Her Majesty a sum not exceeding $67,274,000 for families, other reporting entities' capital investment for the fiscal year ending March 31st, 2022. Shall the resolution pass?
Pass.
The resolution is accordingly passed. So the last item to be considered for these estimates is item 1, subsection A, the minister's salary, contained in resolution 9.1. The floor is now open for questions. Ms. Adams.
I move, seconded by the member for the Paw-Kamisak, that line item 9.1A be amended so that the Minister of Family's salary be reduced to $33,600.
It has been moved by Ms. Adams, seconded by Ms. Laughlin, that line item 9.1 subsection A be amended so that the Minister of Family's salary be reduced to $33,600. Shall the motion pass?
Yes.
No.
No.
I hear a no. All those in favor of the resolution, please say, of the motion, please say yay.
Yay.
All those opposed to the motion, please say nay.
Nay.
In my opinion, the nays have it. The motion has been defeated.
Wait.
What was that? Okay. Okay, if there are no further questions, we'll move on to the resolution. Resolution 9.1, be it resolved that there be granted to Her Majesty a sum not exceeding $8,532,000 for families, administration, and finance for the fiscal year ending March 31st, 2022. Shall the resolution pass?
Pass.
The resolution is accordingly passed. Okay. So this completes the estimate for the Department of Families. The hour being 4:55, what is the will of the committee?
Rise.
Call it 5 p.m.
The time being 4:55, committee rise.